Lyme disease is the most common tick-borne illness in the United States. Was initially discovered in the 70s and was initially called Lyme arthritis because of the symptoms that it produced. There are 3 stages. In the early stage, the patient can typically describe a rash or reddened area, potentially even a spider bite that has appeared, and it can appear in the first 3 to 30 days after a tick bite. Sometimes the rash is described as bullseye or target shaped. In the second stage, they can have multiple reddened rashes or lesions, and this can even cause some cardiac and neurological abnormalities. And the final stage is characterized by arthritis of the larger joints, such as the knees, and you can also have neurological abnormalities such as rare encephalopathies. And this stage can present within months or years after the initial infection. Anyone is at risk for Lyme disease, particularly those that are more outdoors, as the disease does come from ticks. So anybody that is working outdoors or in an outdoor wooded area or grassy area that might be prone to ticks are at an increased risk for the tick bites, therefore at an increased risk for Lyme disease. If a patient presents with possible Lyme disease or concerns for Lyme disease, some of the questions you want to ask is if they've been outdoors, particularly in wooded areas or grassy areas that they could have encountered a tick, or if they found a tick on them. As those that are in these outdoor areas are at an increased risk for tick bites, therefore at an increased risk for Lyme disease. You also want to ask if they've noticed any reddened rashes on them. It could be, again, that bullseye appearance. They could describe it as a spider bite, or it could just be a generalized 1 to 2 inch reddened area that's flat. And typically they don't itch, so the patient doesn't complain, and they might even miss it. Finally, you want to ask if they've had any flu-like symptoms such as fatigue, joint pain, fever, or chills, because flu-like symptoms are common in the early stages of Lyme disease. When you're examining your patient, 3 of the important physical exams that you want to make sure that you perform is going to be a good thorough skin exam. You want to make sure that you assess for any suspicious rashes, lesions. Even if the patient doesn't report any of these lesions, they could have areas that they can't see, and so they might miss having had something because, again, they're not typically painful, they don't itch, so they very well could miss a rash that is there and they just can't see. You also want to assess the lymph nodes, especially if you do find a lesion. Make sure you thoroughly assess the lymph nodes in that region, as lymphadenopathy is also very common with Lyme disease. So you want to assess for lymphedema or tenderness. You also want to assess your musculoskeletal system, assess for any arthralgias, muscle stiffness or tenderness, and myalgias, because those are very common with your Lyme disease as well, particularly your knees and larger joints. Treatment, there is a treatment. It is aimed to shorten the symptoms and prevent any progression of the disease. So typically you're going to be treating the patient with doxycycline for 10 days or amoxicillin for 14 days. There is a prophylaxis treatment for those individuals that are concerned about getting Lyme disease after they found a tick on them. And per the CDC, they don't recommend treating with the doxycycline prophylactically unless the tick was actually on the patient for 3 days or more. 3 of the key components you want to make sure you educate your patient with is let them know that even with treatment, that the early stages of Lyme disease and the fatigue and muscle pain can last for up to 20 days even with treatment. So that doesn't mean the treatment failed, but it can last for that long. And also, while treatment failure is possible, it's very rare, and it's usually just associated with the patient not completing their antibiotics or taking their antibiotics as prescribed. So it's important that they take all the antibiotics as prescribed. Finally, some patients do experience post-Lyme disease syndrome, where they have subjective symptoms like a headache and fatigue and joint pain, but this is not an indication that they need more antibiotics. Unless there's signs of a co-infection, they don't need more antibiotics, and the symptoms can be treated with over-the-counter medication.